Welcome everyone. This is Jaysharan Suganam here here to speak about ICDI. ICDI is a device I had created to monitor and control anxiety. This is basically to help people diagnosed with anxiety disorder. Let me start with what motivated me to take this project. In my high school, in my penultimate year of high school, I was diagnosed with anxiety disorder and it took me 4 years to completely recover from it. Completing my high school was biggest challenge while while dealing with anxiety disorder. So, knowing the severity of this disease, I want to come with a device which can help people diagnosed with anxiety disorder to control their anxiety levels. And statistics says that 1 in 5 people had a 12-month mental disorder. Anxiety reduction model. For reduction of anxiety, I'm using the following model. First, we are categorizing anxiety into three levels. One is mild anxiety, other is moderate anxiety, and severe anxiety. And to reduce anxiety, we are using three IoT sensors. One is heart rate sensor, which is used to measure the heartbeat. Another is accelerometer, which is used to identify tremor. Tremor is another name of trembling. Uh, Hand shaking and hand trembling is what the feature we are going to use. And sweat sensor to use to identify the sweat level. Here, heart rate sensor will be used for all level of anxiety, whereas accelerometer will be used only for the moderate and severe anxiety levels. Sweat sensor will be used only for severe anxiety level. The values used to classify anxiety is as follows. Basically, a normal heartbeat is in the range of 60 to 100, and while a person is anxious, his heartbeat automatically increases. So for mild anxiety, the range chosen is 100 to 110. Moderate anxiety, 111 to 125. And for severe anxiety, it's greater than 125 BPM. BPM is blood pressure per minute. Sorry, beats per minute. And accelerometer. Accelerometer provides angular acceleration data. So based on the angular acceleration data of our hand, we are going to detect the anxiety. So if the angular acceleration is in the range of 0.214 to 1 radian per second square at 12.3 degree to 57.3 degrees per second square. It is classified as moderate anxiety. For severe anxiety, the the angular acceleration should be in the range of 1.001 to 2.36 radians per second square. And severe anxiety is detected when a sweat is detected in hand. Basically, we are implementing a wearable wrist device which is used to monitor the anxiety. Coming to the application architecture, we have two applications designed for this purpose. One is patient, another is counselor. The patient portal has the following features: patient application alert, patient profile, live monitoring, sensor data, guided motivation, patient progress check. Once the sensor data is received, patient will be able to live monitor his da- his sensor monitor the sensor data live through his mobile application. And when anxiety is detected, Based on the level of anxiety, patient will be receiving an alert suggesting him uh, mo- suggesting him techniques to instantly reduce anxiety, and also some motivational videos. So this will help the patient to calm himself, so the anxiety is reduced. So this is how we are controlling the anxiety level in a patient. And if the anxiety level is severe, the counselor or the psychiatrist will be receiving an alert saying that the patient is having some severe level of anxiety. He needs help. And also the date abnormal heartbeat data, the frequency of tremor detection, frequency of sweat detection, all these details are maintained in the database, and monthly charts are prepared based on that. Also, patient have access to many many motivational videos and some mindful videos which will give a good insight about anxiety. Also, he will be able to access the exercises and yogas and the techniques suggested by the psychiatrist or the counselor. Also, the patient will be able to monitor his progress in patient progress check. And counselor and psychiatrist will also be having access to the patient's profile, the patient's sensor data, and patient's progress check. So the counselor can understand the situation of the patient better. Evaluation of research. Let's see some limitations and strength of the paper. So let's discuss the strength first. First strength is the parameters used for this classification and for detecting the anxiety disorder is accepted by renowned clinical psychologist Barbara Rajan from Tamil Nadu. And based on my research, I found that the heart rate increment is the most primary characteristics to detect anxiety. So I am pretty sure that I had chosen the right parameters. Biggest challenge faced by a clinical psychologist is evaluating a patient based on the verbal responses, like the patient the clinical psychologist um, evaluate the patient only based on his responses on the counseling or the meeting day. But but this device helps, but the proposed device will be helpful for the clinical psychologist to analyze the patient um, at least two times better. And personally, my biggest concern with my anxiety is I'll be losing my consciousness. Like when I when I'm like I'll not know when I'm exactly getting anxious. And once I get anxious, it's very difficult for me to recover from it, because it will take a long while to control myself. But this device notifies the user earlier, so he will be able to control the anxiety before it gets worsen. And coming to the limitations, the values determined for analyzing the level of anxiety may not be accurate, and no experiments is done based on this device, so we will not be knowing the accuracy of the device yet. And while I can say that the sensors and parameters I had chosen is correct, to detect anxiety, but they may not be sufficient to detect anxiety in some scenarios. All these sensors, all these sensors are multiple emotions, not only anxiety for sadness, for depression, for angry. All these emotions, the heart rate heart rate sensor will be used. So to classify anxiety from them, we need advanced artificial intelligence based algorithms. Speaking about my further research plan, I want to add more parameters and sensors to detect anxiety and develop effective algorithms based on artificial intelligence to classify anxiety. And once I get successful in this device, I want to develop devices for multiple mental illness like stress, depression, bipolar, schizophrenia, etc. And I also want to make my outcome of all my experiments available to the public database using platforms like Physionet.